Now let's describe the straightforward elements of a recovery toolkit for youth sport coaches. Immediately after an incident, you should talk to an athlete, assuming that they're capable of speaking with you at that point, an athlete, how they're feeling. This may prompt the athlete to describe symptoms that might otherwise go unreported. Document all relevant information, not only on the incident report and symptom tracking chart that you give to aid the parents, but also on an injury incident report form that you should have available in your first aid kit from your youth sport organization. You may be asked to recall the details of an incident long after that incident has occurred, and accurate recording of what actually happened as soon as possible will help you to document that kind of information. Parents may also ask you for advice about where to go to seek medical evaluation and treatment for their child if the child has been sent home with that requirement. Medical professionals trained in the assessment and treatment of concussions can be family physicians, pediatricians, sports medicine doctors, neurologists, and neuropsychologists. These professionals may be found in hospitals, concussion centers, or in private practice. Sometimes your player may show up at practice one day wanting to participate after having experienced a concussion. With the basic understanding of the recovery protocols, you should know what questions to ask that player and their parents about where the player is in the recovery process. Questions like, are you back to school full time? Did your doctor go through the return to play protocol with you? And finally, and most importantly, have you obtained uh, written medical clearance to return to play from your physician? The second part of the recovery toolkit is to understand that physical and cognitive rest are the keys, along with gradual increases in the amount and intensity of physical activity. Whether that rest is cognitive, how they think, relaxed thinking, whether it's physical, avoiding strenuous activity, whether it's social, limited interactions with others, and opportunities to sleep, which permits the brain to heal. All of this are part of what we call the therapeutic rest that's required to recover from concussions. Gradual rest and an increase in cognitive, physical, and social activities are the key to recovery from concussions. Rest and sleep permits the brain to heal. Although gradually increasing exercise was previously thought to be necessary because the body needed time to heal, therapists now understand that the gradual increase of exercise can actually be part of the therapeutic process itself. Exercise can increase cerebral blood flow and be a positive factor in the healing process. Such therapy needs to be done under the supervision of a qualified medical professional because the patient may crash if the exercise is introduced too intensely or too quickly following a concussion. Research is continuing to examine the relationship between exercise and recovery from concussions. The recovery toolkit continues even after medical clearance to play has been obtained. The coach should continue to monitor the player after they return to play for the possibility that concussion symptoms may actually return. Slowly increase both the cognitive and physical demands of your practices or of the competition. And remember that too much too soon can actually prolong recovery. We've learned a lot about concussions over the past decade, and new information is coming in virtually every month. We now know that a concussion is a brain injury, more than just a ding or getting your bell rung, and we can't just walk it off. The recently released CDC guideline on the diagnosis and management of mild traumatic brain injury among children recommends that we call it what it really is, mild traumatic brain injury. In summary, we know the following. Children take longer to recover than adults, sometimes as much as twice as long. We've learned that returning too soon to normal activities can prolong recovery, and that includes returning to cognitive and social exertion as well as physical activities. We know that physical and cognitive fatigue are quite common symptoms as the brain uses energy in the healing process. When a brain is concussed, energy is diverted from normal activities to heal the brain injury itself. A concussed brain is at higher risk for a second concussion or an injury of any type. We know that concussions temporarily changes the way we respond to our environment. Our sensitivity to bright lights and loud sounds may be substantially affected. It often interacts with the severity of the symptoms. Think about the times that you've had a headache and how that impacts sports performance, reading, watching TV, or working on a computer. One of the most important things that we are now aware of is the second impact syndrome, or SIS. We know it's quite rare, but it's also quite real. And one of the best reasons to do everything we can to prevent concussions and manage them properly is to prevent the occurrence of second impact syndrome. The proper balance between rest and activity is the key to recovery. More recently, we now understand that especially for athletes, the proper management of concussions include understanding when and how each individual recovering from concussion should rest and what activities should be incorporated into the recovery. We have known that concussions happen outside of sport, but now we know the signs to look for and questions to ask players and parents when we see a difference in a player's behavior, whether that concussion occurred inside or outside of our sports arena. Organized sports are typically a safe, healthy activity for children and youth. When, however, the possibility of mild traumatic brain injury arises, remember, we each only have one brain. We need to protect it. The most prudent approach is that when in doubt, sit them out. Thank you for participating in our course. That concludes our program on concussions. Your next step is to take and pass the short test that qualifies you for the certificate